In Texas, the number of new infections among women remains relatively constant, with slightly more than 1,000 new cases of HIV each year. Heterosexual contact accounts for many of these new HIV infections. According to the CDC, it is critical that opt-out HIV testing be integrated routinely into reproductive health services.
A lot of people are coming in for STD screening already, and people would come in for gonorrhea and chlamydia testing and not get HIV or syphilis testing. What we're doing now is really saying, present this as a package. How the staff talk about it and how they ask clients about it is, to me, the crucial piece. In the past, people have come in and said, okay, I want gonorrhea and chlamydia testing, or I'm here for a well woman exam. And the staff will say, well, would you like an HIV test today? And when you ask people that, it just seems like automatically the response is, no, I don't think so. You're kind of giving them a choice. And while we're still giving them a choice, what we find is that if you say to people, today we're testing you for gonorrhea, chlamydia, HIV, and syphilis, they'll say, okay, that sounds fine. And it makes a huge difference in the number of people that are testing.
Many women of childbearing age rely on family planning as their only healthcare provider. Increasingly, family planning providers also see male patients. People living with HIV benefit from being tested and diagnosed early on in the process of the disease.
We do have individuals who are young who test positive. In our fan and family planning clinic, which is our biggest health center. Since I'm located in that, I often get called to give positive results. So I have had the opportunity to tell quite a few young people that they're positive, which is always difficult. But last year, 1 week apart, I had two 16-year-olds. And when someone's 16 and they test positive, you know that they're early in the disease. And so while it's very sad, it's also, we also get those people into services and into care, right away, so that then they have a chance to live a long and productive and fruitful life.
We did have one young man who was 16, who had one sexual partner, who was an older woman, and he tested positive, so we were able to notify him early. We've also had patients who were drug abusers who really never got tested, and, again, to support their habit, some of the risky behaviors that they engaged in put large numbers of individuals at risk. So, knowing your status early may modulate your behavior in terms of spreading the disease.
And while with each visit we don't do a long education process with them, we do talk to them about the risk of having several partners. We talk to them about protection and how to reduce their risk.
There are advantages and disadvantages for both rapid testing and for conventional testing. The best testing methodology is the one that best fits clinic flow.